Hey guys, this is Dr. Hub. Today we look at the FAB classification. So under FAB classification, we look at M0. M0 stands for the minimal differentiation. Then comes the M1. M1 is for the without maturation. Then comes M2. M2 stands for it is the most common, as well as it has the Th21. There is also presence of the chloromas, and it is a good prognosis. Now let's look at M3. M3 means it is promyelocytic. M3 means it is promyelocytic, and it is a young good prognosis. In young it is good prognosis. And it is T1517, and it is intermediate. Then it also has the presence of the OR rods and also the DIC. Next we look at the M4. The M4 stands for the myelomonocytic. So M4 stands for the myelomonocytic. So it involves the INV16 as well as the T1616. Next, there is also presence of the eosinophilia and the gingival hyperplasia. There's eosinophilia, there's gingival hyperplasia, there's inverse INV16 and the T1616. Then we move on to the M5. So M5 contains the M5A and the M5B. M5A means it is monoblastic, and M5B means it is monocytic. So let's look. So the important things here is that in M5A and B, it involves the organ infiltration. There's organ infiltration. Then there is also the gingival hyperplasia. There's gingival hyperplasia. Next, it also includes the increased WBC count, and there is also presence of fever. Then there is also the sweet syndrome. There's presence of the sweet syndrome. Next is we look at M6. So M6 means there is erythroid. So erythroid, there is it is therapy related. It includes a erythemic myelinosis. There is also the D. Guglielmo disease. This presence of D. Guglielmo disease, and it has a poor prognosis. This is M6, poor prognosis. Then we look at the M7. So what is meant by the M7? So M7 means it is the megakaryocytic. It is megakaryocytic. So what are some important points here? The important point is that there is CD41 as well as 61. Then it is a bad prognosis. So as the numbers increase, we are seeing it is a bad prognosis. And there is Down syndrome. That is, there is a good prognosis. Next is there is also presence of the bone marrow fibrosis. The presence of bone marrow fibrosis is increased in case of the PDGF.